Right, hello everybody. I'm going to call you to order. I hate to do this because I'm loving seeing all the kind of conversations and connections that are going on. This is what it's all about, really, isn't it? It's about talking to people you don't know, connecting as a network and a group of people. Hopefully the outcome of a day like this is that we're all more connected as a community around health coaching and beyond. And so this afternoon's session, we've got a panel discussion. And you've already heard us many times allude to the fact that health coaching only really works if you're taking people in the context in which they live. Their community, their spaces, their friends, family, carers, loved ones, you know, the kind of rich network that makes up your life. And so we are really privileged to have 4 people who I have deep respect for on our panel. I'm going to let them introduce themselves properly in a second, but first of all, we've got Mick Ward here, who's come down from Leeds, has worked with Leeds Council for nearly 3 decades, isn't it? Sort of like 4 decades, sorry, yeah. Really leading the way in asset-based community development. Next door is Connolly, who works with me and the PCN in Heeley Plus area. You saw me point her out earlier on with the work we've been doing with Heeley Trust. And then June next is come up from London with her team here with June, and has been doing really innovative work with the Wandsworth Community Empowerment Network around how volunteers and communities play a part in the coaching work we've been talking about. And Justin Rowntree, who is the leader of a community interest company in Sheffield, Blend Kitchen. Many of you will have eaten there and seen what they do. And Justin, I'm sure, will very articulately describe the mission that they're on as well. So 4 fantastic people. What we've tasked them with doing is having 5 minutes each just to introduce themselves and their organisation. I haven't given them too much guidance, so I'm not quite sure what's coming. But I will hold you to 5 minutes if that's okay. If you stop earlier, I might ask you a question. And then we'll spend the rest of the hour with sort of fielding questions from yourself. But anyway, shall I pass over to, where are we going to start? We're going to start with you, Mick. Shall we go this way? Is that?
Suits me.
Over to you, Mick. Thank you.
Thank you. Hi, so I'm Mick Ward. It's actually more than 4 decades. And I will start with that because it is relevant. So I worked in health and care in Leeds for 46 years, starting as a care assistant, but I did end up as the Deputy Director of Health and Care. And I mentioned that for 2 reasons. One of which is the stuff we did on ABCD was not an add-on. It wasn't some sort of project. It was a fundamental shift in how we thought about applying what we were trying to do to get the outcomes. And then the second thing, although the huge amount of my time was spent on care homes and home care and community equipment and mental health day services and learning disability support, I don't think we'd have been able to continue to deliver and fund that if it wasn't for the work we did and the benefits of taking an asset-based community development approach. So when I left that, well, a couple of years ago, I deliberately decided to work with an organisation called Nurture Development, who are probably the lead international organisation on proliferating ABCD. And in fact, while I'm here in Sheffield, my colleague Cormac's doing a similar session, but he gets to do Singapore. Much as I love Sheffield, but there you go. As we go. And the reason I became interested in it was because I began to realise, way too late in my career, through picking up stuff from Cormac, Russell and others in ABCD, that community and neighbourhood is possibly one of the most single important units of somebody's health and well-being. Yes, services are important. Yes, individual support is critical. But what is underutilised is the potential of neighbourhood and community. And what ABCD crucially gives is both an understanding of that, an ethos. But what I particularly liked is in my role as leading on commissioning, it also has a framework. So that ethos can be summed up with focus on what's strong, not what's wrong. So what is it that's there within a neighbourhood, within a community, that can be nurtured, that can be identified, that can be celebrated to bring about that change? And the framework is really simple, which is to fund or employ, you can do both, community organisers, people with a very defined area that they work in, something where everybody who lives there says, this is where I live. You know, people know the neighbourhood. And their role is really simple, is to go out and find community connectors, people willing to give of their own time, their own passions, make connections for the benefit of themselves and that community. What they are, we're less interested in, as long as it brings people together. To celebrate that community, to do what's called asset mapping, to really identify what's going on in the community, and sometimes use tiny, tiny bits of money to help nurture those things together. And what we found in doing that were two really critical things. One of which is it began to turn on its head the relationship between organisations and citizens, because it was inevitably citizen-led. That's something you will see a huge interest in more radical thinking local authorities and in more modern thinking NHS organisations. The second was the huge range of outcomes. I initially got involved in it because its potential around tackling loneliness. That was one of my remits in Leeds, was about improving people, tackling social isolation. But what we discovered from hearing the stories of those community connectors, from monitoring what was going on in those neighbourhoods, was a whole range of stuff in terms of community cohesion, improved family life, shared childcare, tackling local economy, improving local environment, and of course health and well-being. And not just tackling loneliness, things like people being more and more engaged in their own health and connections. And where it really fits in with this is both a connection, and I would suggest a tension as well, between individual support and thinking about things at a neighbourhood or community level. And my learning from that really came between the tensions between what we were doing and social work, but I think you could probably apply some of this to health coaching. And how we resolved it was a simple idea. It's when social work started to move to what's called strength-based social care, focusing on an individual's strength, where I was thinking about community strengths. And it was my boss, the director, Kath, who really came up with this. And we simply thought, it is no use us doing all this stuff in community if somebody goes into the system, be that through the NHS or the local authority, and they immediately hit a professional who does an assessment, thinks about eligibility and sends them to a service. But then, on the other hand, it was no use beginning to think about the strengths and potential in community if there were not going on. And crucially, not only in terms of nothing going on that that person could then access, but actually there wasn't space for them to become that person. So my big hope for health coaching, it can do those two things. Support not just individuals themselves, but individuals in their communities and connected with their communities to connect more, but crucially to think about their own strengths, their own passions, what they can bring, not just to their own health and well-being, but to their community's health and well-being. Thanks.
Fantastic. That was absolutely spot on 5 minutes. Well done. Thank you. Over to you, May.
Hi. Yeah, thank you. So May from Heeley Trust. Heeley Trust is a place-based organisation in Sheffield working across Heeley and Gleedless. And we started 25 years ago, something like that, with a bit of land that we needed to develop, and we had no money. And so we weren't grant funded, so we drew on the strengths of our community. We went out and we said, what can you add? What do you want to see in this bit of land? You know, who wants to look after this bit, and who's going to look after this bit? And that's where it started, really. And from that, we then used a strength-based coaching approach to building new projects, building community around the park. We got approached to do a bike project, which is now, 15 years later, an award-winning independent bike shop of the year, a different gear in Sheffield. We also have a recycling project attached to that, where people can come in and fix their own bikes up or recycle bikes that are then sold on. Alongside that, we have a number of other projects, but my role is to manage the community team, so it sort of does what it says on the tin. And we go out and we work in community and we build community. And I think that a lot of what's happened at Heeley Trust over the years is there's been a real approach to taking what people are good at and taking their skills and saying, right, what can you bring? And I think that similarity is that invitation to what do you bring to this exchange? So for coaching, it's, what are the strengths that you've already got? What do you want to work on? Well, that's the goal, but how are we going to get there? What can you bring to it? Okay, well, I'll bring this bit and we'll join it up and we'll, meet halfway through and review it. And that's very much what we do in asset-based community development. Our version of it is to do that and to invite everyone in to solve their own problems of the community and not to have services helicopter in, fix a problem and then run again when the money runs out. And so that's a big part of it. Another part for us is around the assets, and we look after some buildings. We don't own them. We don't see it as ownership, but we a long-term lease over 100 and something years, as I say. And from that building, there's 25 units that we let to small medium enterprise, who we then also coach to be to link to where they can get business coaching and financial advice and things like that. The money made there goes back into the community. So we're also trying to create sort of a circular economy within that. And I guess that's, for me, the similarity where the strengths are that we work alongside each other is that we're doing that with community groups, we're doing it with small businesses on patch, we're doing it with other services and organisations. You guys are doing it with one person and then giving them permission to go and do that in the community in other places, and that's really important. So I think for us, working as community development workers and social prescribing link workers, working alongside the coaches and having that coaching model to what we do, has meant that we've learned a lot and been able to change our practice as well. And I think that works the same for, I would say, the coaches in our organisation. For us, the ability to sort of see the people that come through coaching who then get involved with our community groups in the community bit that we've developed where we've got groups, it really does trickle down, that thing of you've given someone some strengths, some way to set goals, and then they come however long later and they're ready to volunteer at the library with us. And I see it in practice. I see Tracy, who works in the library, then coaching other people in her coffee morning to sort out their problems. And it just kind of reminds me that all of this stuff we're talking about, coaching and asset-based community development, it's all been around for years, right? My mum coached the woman next door when she was trying to sort out, getting the kids to school on time. And it was like, well, you take them to Barbara and they'll look after them for this 20 minutes. And all of that, like we did all of that. We got people to take the strengths of their community and themselves. And for whatever reason, that's been lost over time. And now, people within the NHS have picked it up and they're ready to fund it, and that's great. I think the pushback is around the evidence base for it, and we've got a really strong evidence base of coaching and social prescribing, but not so much community work in some areas, and so getting it funded can be challenging. That's been, I guess, one of the barriers for us to it. But for us, the real strength in coaching and taking a coaching approach to community development, as well as a community development approach to social prescribing, link work and coaching for the social roles, has been the shared knowledge and hive mind that you get from that. So, I think that's it. Thank you.
Wonderful. Thanks, Nick.
Okay, afternoon, everyone. I'm June Pilgrim-Ndure from London. We came into contact with Pete's coaching when Thomas, the commissioner, CCG commissioner at the time, now ICB, we work a lot together, Wandsworth Community Empowerment Network. We're a charity, and we came in contact with Pete's because we wanted to do health coaching for our volunteers or people we wanted to come into contact with. And we had a model already which we were working with. We wanted to strengthen that. And I think that when you think about where we're from, we were 20 years in the making. We were always trying to fight for funding. They gave you 5,000, they give you 10,000, and then you're meant to work with that. But we had to use the community to actually develop that. And how, when I remember 2019, coming back from holiday, and Thomas was sitting there for a group of people, and we were saying that we were going to be doing, working alongside to do health coaching. I thought, okay, another project. But like when you think about the voluntary sector, we're always having to evolve. Like we were doing mental health and well-being, and we were doing advice first aid, and we were doing children and young people, and now we're doing physical health as well. And I think that when you look at it, it's about looking at the whole picture of a family and not just looking at a person, because a person comes with friends, family, children, all sorts. So it's making sure that we knew that we were going to commission someone who understood us. So we then met with Peaks, actually it was Ollie, and a team, and then it was Carolina as well at the time, and they came and spoke to us about what we wanted. And I think that when we looked at that, we told them that our community is different, because how we work is we are the voice for the community that don't get to the 9 till 5 meetings. You know, when you go around meetings, you see the same people, they sort of like advise you, discuss about you, but you're not actually there in the meeting. And we were the voice for the community, which was the faith groups, the churches, the mosques, the community groups, all those that were actually doing the work and not actually at the meetings. We then got the information for them, and then we got them involved by inviting them. But we got the community to be there, but in the evenings and the weekends, and not just when it was 9 till 5. So I was making sure that we sort of like got the commissioners to come to the community and to actually work with the community to develop services and strategies for them. And they got their voice by doing that. And it was sort of like so interesting how we then got the community trained. They wanted to be speaking. They're the ones who have the footfall. People go to mosques, they go to churches, they go to community centres on a daily basis. And it was getting the actual coaches in those communities to be trained to be coaches. And then they were able to actually deliver services to the people that they see each week. Because when you are going to a church or a mosque and someone sees you every week, you can recognise the change that's coming. So if someone goes to a church on a Sunday and they are looking immaculate, and then one time, gradually they start to look different, you can see that something's going on with them. They come, and we don't always sometimes have time when we're sort of seeing people regularly to ask them how they're doing. You know, so it's like making sure that people knew to spot those differences, spot those changes, and then to develop services that they can actually utilise and use. And when I think about the coaches that we serve, some people have nothing to do with medical. They're not medics. They're not anything from they're not diabetes trained or anything like that. They're just common people who we taught the model, and then they use their skills, and we train them to actually gain the knowledge about diabetes, about long-term conditions, about all the things that you need to know. And then once we've done that, they were then able to do the coaching for each other. And they were able to sort of like speak to each other about how they felt things could change for them. And one of the things that we noticed as well is the coaches were eager to help their communities and to help the people that they served. You know, and I think it's important that they weren't looking for payment, you know, that they were looking for skills and abilities. Some of them are trained nurses, they're trained practitioners already, but they were using their time to give back something to the community that doesn't come. And one of the biggest things is that we are, our work is all about prevention and inequalities. And I'm sorry, but the inequalities usually stem from those who are doing the work, the porters, the nurses, the people who are sort of like not able to get to the doctors 9 till 5. So in the end, we then were doing health checks and events at the weekends, so that they, and in the evenings sometimes, just to make sure they had a space to get their blood pressure checked. So come and speak to a coach about how things are going on for them. And when we sort of like started doing that, we started regularly going to different places. So we would work with the different, in Wandsworth we've got like areas, north, west and south like everyone else. And we would then work and have events north, south, east and west, but different places, so people had an opportunity to come to those. And it was just making sure that when we saw those people in those services, we don't always have an opportunity for them to come back. We would direct them to go to their doctors or go to the people that we know. We created relationships with other people in the community that we could signpost to. And not signpost, refer. Because when we signpost, you're saying, oh, here, you can go here. But what we had was relationship built with different people in the community, and we was able to say, okay, I will phone, leave this with me, I'll find something out, and then I'll come back to you. And then they were able to then sort of like go to the, I can see Ollie standing, so I've got 5 minutes up. I thought I couldn't speak for 5 minutes, but look at that.
We could listen to forever.
But, you know, I just think that what I just want to lastly say is that people are in the community know their community. And, like, we've got people here today. I brought 4 volunteers with me today. Some of them work, some of them don't work. But it's just making sure that they know that they are important to the work that we do. And I wanted to give them that experience. So thank you.
Thank you. I'll try and keep to 5 minutes. I'll try and tease with a few things that may stimulate questions. I will try and keep to 5 minutes. I want to share a tiny little bit about me, my background, how I've got to this point in my journey. I want to share with you the experience of Blend Kitchen, which I'll go on to talk about, and how we've created what we've created and what the impact it's having. So, very briefly, behavioural science background trained.
I was in recruitment and HR for 10 years. Without realising it, I was applying a coaching approach within that in terms of building teams and helping people achieve their goals. I was then in hospitality for 12 years. Again, without realising it, I was seeing the power of coaching in terms of helping my team develop their best ends and had a really high retention rate of staff because they were enjoying what they're doing, because they were achieving their goals. I then went into consultancy within hospitality, and again, I was helping people build teams, achieve goals. So I knew that coaching was really important. To that extent, about 2-3 years ago, I started my training. So I'm doing an ILM level 7. It's taken a little while because life has got in the way. I finished that in a month or two, which is amazing. And then at the same time, Blend Kitchen, which is a social enterprise restaurant which supports vulnerable adults and people with a raft of backgrounds that affect their health and mental health. We give them life opportunities and training to improve their lives. And all those things have combined to the point where now I'm running Blend Kitchen. And what we've created there is a real coaching culture. And so I want to share with you how we've done that and why that's valuable, and how a lot of people in this room can perhaps help us progress the kind of work that we're doing. So with this knowledge and the knowledge of the benefits of coaching, what we've created is a number of advocates within the group that have all gone through the peak health coaching. There's 5 now that have gone through that. So we're using coaching not only to work with our service users, long-term mental health conditions, lots of neurodiversity, lots of physical disabilities as well, to help them improve their lives in whatever way that may be. A lot of it is just them understanding they have the power themselves to change their path. Particularly as an example, some young adults with neurodiverse backgrounds who were pretty much told from a very early age, this is the path you've got, these are the things you can't do, these are things you may be able to do, but they're really life limited by what they're told they can and can't do. But once they're actually given a one-to-one opportunity to look at their health opportunities, their life opportunities, we've seen them absolutely flourish and make decisions and take on paid work and do things that we can see their parents never knew they could do, or never thought they could do, or never had the belief they could do. So that's an incredible example of some of the things that are happening. Another example of how we're making change in there is the 2 of the people that have gone are actually on the training are actually service users themselves. So one gentleman is a recovering addict, and the other has a long-term mental health condition. And they are now having peer-led coaching with the rest of with their cohort, if you want to call it that, and that's incredibly powerful because we've created a trusting, nurturing, safe environment where people can bring their whatever their background may be, health-wise or social backgrounds of deprivation, and they feel safe to talk about it. So that is something we've created in the community. The other things that we're doing are now creating community-led events, which are being developed and led by people with lived experience, and these are incredibly powerful. One particular example I'll give you, it's a poetry night, it's a spoken word night. All the people that organise it and run it have lived experience, particularly of mental health, quite long-term mental health conditions, and the people that are coming to that are coming because they feel it's a safe space. The communication and networking that's going on within that, and the ability to people to be referred, people that are coming from really hard to reach communities that wouldn't normally ever come out to a social experience like that, and then are getting help to improve their physical and mental health is quite mind-blowing. So we've created something really special. The health coaching approach is absolutely critical to that, and I think the sort of big message I want to give today is that by creating community environments where a health coaching approach can be nurtured and developed is absolutely making a difference to people's lives on a daily basis. How we scale that up, how we develop it, I'm not sure, but I do know there's people in this room that can help with that. I think I'll leave it there. That's what we're doing. We've got a long journey to go on, but as I say, with people like you in the room, we can definitely do it. Okay.
Let's get that back onto the right slide. Sorry, I've just knocked something as I put my thing there. Let's just play that.
Lovely, thank you very much. So 4 fantastic timekeepers, the first thing to say, that was amazing. But what you can pack into 5 minutes, and it's just an incredible reflection of of the ongoing work you've done. So thank you very much for what you're doing. Just whilst you're thinking about your questions, some of the reflections from me. So, it's just a minute. So, you know, there was a theme of strength-based running through that, wasn't there? And I guess what I picked up was the sort of like, whatever your context, it's always going to be different. You know, that you're trying to create this culture change amongst your organisation, whether it's a specific kitchen like Justin, whether it's a whole city like Mick, you know, and everything in between. You know, it's just how we shift these cultures, isn't it, over time? And I'm sort of hoping you guys are going to maybe sort of like, you know, lead a little bit of a discussion here around how we can achieve that culture change. You know, I mean, June, you're talking about, you know, sort of reaching people that aren't normally reached by services, those people that don't come to the 9 o'clock meetings. But I also heard from all of you the willingness of people to join in. You know, people want to take part, but perhaps they need the safe space psychologically and physically to be able to join in. So I guess maybe I can kick you off. How do we create that culture then? What are the sort of, it's a tough question, but what's the magic ingredient to creating a culture where it's safe for people to get involved?
So for me, my background was mental health, and I trained as a nurse, and before that had worked volunteered for years and years started as a health champion, we called them in Sheffield, but that sort of volunteer level, very entry level, where you're based in your community and you're essentially doing a bit of community development, setting up groups, and also a bit of coaching because you're doing sort of peer support stuff. And so that, for me, is where it started. It's pulling together all these threads. But through that journey, what I found really important was self-disclosure, and I know that there's a lot about whether to do it or whether not to, and what bits how much you can do. But for me, there's two parts to creating that culture in the spaces that I work in. I live in Heeley and I work in Heeley. And for me, it's a little bit of self-disclosure and a little bit of then giving people permission to join in and also be vulnerable, because I think you can only get to that space when you're vulnerable yourselves. And I know that, you know, as a one-to-one, as a coach, you can't sit there and pull your heart out. It can't be about you. But don't also, you know, not to be completely inhuman and to act like a robot. You're not a coaching robot. And that is the start of that, in that one-to-one. And also just giving the people skills to go forward in it. And like I said, that trickle down or trickle across effect of that really works. So I've seen that a little bit in practice. I think we've got a good thing going with our primary care network and having that team of teams approach so that people can then start to mirror that behaviour and act that way. And I think, you know, then people follow, and sometimes people are a bit scared, but giving people permission. So that's my top tip.
Brilliant. Does anyone else want to pick up? I'll pass this one along the line. And thinking about things that you want to ask, I'm going to throw it open a second.
Yeah, I suppose for me, there's two things that are important in getting that, but both of which come with challenges. So one of which is just about celebrating things and putting the spotlight so that when people are doing things within communities, it's recognised as important. One of the challenges in ABCD, because it's not done through a service structure, you know, people are not even volunteers. People involved in stuff don't even know that somewhere way back there's a community builder trying to make it happen. So if you go to, I don't know, one of the women-only pole dancing groups in Leeds that exist on a couple of their big estates, no one involved in that has any idea that 4 steps back away, some community builder was involved in going, do you think that could happen? So there can be a challenge, but certainly putting a spotlight. And the second one is not to fill the space with a service. And the challenge there is that ABCD, rightfully, if you get it wrong, gets criticised by being a bit neoliberal. It's a bit like, we ain't got any money anymore, we're all too busy, just go sort yourselves out. That's not what we're saying. What we are saying is there are some things that maybe services should have never got into. The idea that that's how you get a friend, that's how you connect to your neighbour. And I remember during COVID, you know, like everywhere else, Leeds was inundated with volunteers. But I think the difference was, as well as looking at that formal volunteering and matching up, we put as much energy into putting a spotlight where people were coming together. And I always remember our director challenging somebody in the NHS who was going on about DBS check. She said, I'm not going to have somebody who lives at number 32 Connolly Lane having to have a bloody DBS check so he can go pick up some prescription for somebody at number 36. So instead, what we did is we just said, this is happening, go do it yourselves, because we love what you're doing. And you have to celebrate it.
Thanks, Mick. Brilliant.
Wandsworth. I think with us, we work across the borough. And the big thing that my boss always says to all of us is relationships. You can't do anything unless you've got the relationship. And it was building relationships not only with the community, but also the PCNs, our commissioners. It's making sure that everyone knew Wandsworth Community Empowerment Network. And we've got a project called EMIP, and it's Ethnicity Mental Health Improvement Project. And that project has now been commissioned because it looks at a holistic approach. It looks at all the different elements that you might need. And when you think about bringing people together, you do have to know them personally. You can't just sort of like, you have to worry about what they're going through as well as what the service users are going through. And we don't really have service users, we have people and we have persons, and we enable and we facilitate, and we try not to have patience, and we do not have, we don't use those words because we're speaking to people for people. So it's making sure that we know who our relationships are with people, and it's making sure that they know how important they are to us.
Yeah, I think reiterate a lot of the things you guys have said is relevant to Blend Kitchen. So just one sort of other point to look at for us that's most important, it's knowledge. We're not, a lot of the people within Blend Kitchen, they're not healthcare professionals, so to know about diabetes or to know about neurodiversity or long-term mental health conditions specifically, we don't have that knowledge. So yes, we're building skills of working with people with health conditions and giving health coaching. What would really strengthen our sort of arsenal is better relationships with the healthcare professionals to know whether it's signposting or just better knowledge of the conditions we're dealing with. So that's our little simple cog in the wheel that's missing at the moment that would make a big difference.
Lovely, thank you. Thank you. So it is all about this partnership, isn't it? It's not one or the other, it's the relationship that's going on. Thank you. So I'm going to throw it open now, and I'm going to run up with the mic. I don't think there's many questions coming from the mentees. Has anyone been trying it and I've just not seen it? Or no? Anantha, you're going to come and say something. Brilliant, great. Oh, did you? Sorry, let's come up with you.
Oh no, so I'm going to have to admit this is my question now. So my question was something like, how can we help some people who work within and lead services, NHS and social care, to be less sceptical and less worried about asset-based community development and approaches?
I'll start with one. You have to share the outcomes about it. And it's interesting, there was the comment earlier about how do you prove its impact. And how you prove its impact is you listen, you don't count. But what you listen to is the depth of those stories, and you share those. And then the clever bit, which sounds a bit Machiavellian, is to link them to what you know the outcomes those organisations are trying to achieve. And I'll be honest, I had a story for every occasion. So if I was with the Director of Environmental Health, or if I was with some councillors who are obsessed with car parking, I'd have an ABCD story. But that was done by those community builders constantly listening and then sharing what was going on. And not in the terms of monitoring the contract, it was sharing them as part of that celebration and monitoring the contract.
Yeah, I think I echo that, and we're all in different spaces, right, at different levels, but just having a really positive story to tell around coaching, whether it's your own experience or someone you know of, because that does filter through and it gives off, so whether it's coaching or the asset-based community development, just talking about it in a positive way. But also, I would say for those of you working in coaches, whether it's NHS or with another community organisation, go out and find out who your community anchors are. You know, the NHS is one of the anchors in our society, but community organisations, like some of the ones up here, are real anchors as well, and they have a role and a function, and part of that is community development to whatever, you know, brand of it that they're following, and most of us are pretty ABCD now, but not all of us. So going out and finding those stories, and even if it's 10 minutes searching Google for what organisations are on patch for you and making links with those so that you can learn about them, so that everyone is saying the same stories and telling the same sort of tale of how impactful it can be. And then when if you are ever going out and reviewing or doing case studies or reviewing your work or reflecting on your work, thinking back to stories from those people that you've seen where they've come back and said, this, I then went to this group or I then went to that group, because that is community development work, and the groups wouldn't be there otherwise. You wouldn't have anything to direct people to.
I think for us, it's making sure, because we are now working with the primary care networks, and before that we were working on our own. We were trying to get the health and wellbeing events just delivered, health events. We're doing health checks, and now we've actually started to put in actual things like cancer, prostate cancer, looking at like mental health, all the different things that people might be worried about. And like when we do the health check, you've got the health check, then you've got the actual talk, or then you've got demonstrations on how to cook differently. And it's like putting all those things in that makes the GP sit up and listen, because our GPs, they are the GP surgeries. They now give us the healthcare assistance, and they allow them to come and do the blood pressure, and they now want the data. So now that we're sort of like recognised with what we do, they now want to get involved a lot more. And I think, but that took a long time. The organisation's been going for 20 years. And like in that time, we've had to change differently, evolving all the time around funding. And now we've stuck to our guns and said, this is what we're doing. And it's trying to make them come on board with us and see that, what we're doing is important, just like what they're doing is important. So I think it's about consistency and continuity, and just making sure that they see that patients, they're coming back to them and saying, oh, did you hear about EMIP, or did you hear about Wandsworth Community Empowerment Network? And WCEN, even if you Google WCEN, we come up first, because now it's as important as everything else that's happening.
I mean, again, I'm really new to this world, I've got to be honest, so I don't think there's a lot of depth I can give you. I can just give you my experience of what's happening at Blaine Kitchen. And we know we're doing something right. We know we're having impact. We were really proud to have won Social Enterprise of the Year just recently. So we know we're doing something right. And we know the stories there are very significant. We know we're also getting funding from funding bodies based on what we're doing. But a lot of it is we're saying that these things we're doing in terms of a lot of the peer-led coaching, a lot of the healthcare coaching, the impact we're having on people's health is why we're getting funding. So we know it's something right. How we get that message out there, how we make that much more clear, how we make it much more visible, I honestly don't know. I've got to be honest, we're just fighting fires every day at Blaine Kitchen because we're running a hospitality business, still coming out of a recession and COVID. But we know we're doing something right. We know it's having impact. How do we make it more visible? I don't know the answer to that today, I'm afraid.
Lovely. Thanks for the honesty there. And I think that listening, not counting, is an interesting phrase. It's really going to stick in my head. Thanks, Mick. Other thoughts or reflections? Anybody want to volunteer anything for their own experiences of trying to, bring health coaching into the community development aspect of things? Oh yes, lovely, great. Let me run up. Might get to pass that along. That's okay. Thank you. I know it's tricky, isn't it, speaking in a big room, so I really appreciate people asking questions.
Connolly Valley PCN, we have a very engaged low-carb community that started off as a Facebook group, and then they kind of evolved out of a wellbeing hub, and we've got 3 kind of wellbeing cafe, volunteer-led, peer-led groups, and park-run group, and they're doing all sorts of stuff. They've got a swimming group. They're doing cooking demonstrations that they live stream on Facebook. They're doing all sorts of stuff, and it's fantastic. But then, as a PCN, manager, saying, how do we kind of? We don't want to rein them in because we don't want to dampen the enthusiasm. But then people say, they've done that, and then they've created a leaflet, and then they put this on, and perhaps they shouldn't be doing this, and then worries about insurance and things like that. So it's just kind of how we. So we thought about maybe having a volunteer handbook for some aspects, but we want them to also be able to still initiate their own thing, because this is really a bottom-up movement. But how do we kind of keep the kind of insurance and managers kind of happy as they're kind of going off in various directions, and just to keep people safe as well. There's a little bit of safeguarding there, I guess. So just how do we kind of balance that?
So my initial one about keeping managers happy is just don't. Because anything you try... Because if you're trying to do that, you're probably not doing, the bit that's needed by community. Let's be honest. We all have managers and we all have systems that we have to work in. And often the systems work for the system. And that is just unfortunate. We all know that from various parts of our lives even. So my first bit would be don't worry too much about that. And then speak to the group and get a steering group going and saying, right, what is the aim of this? What do we want from this? And now we give it to you. Now do it and make it sustainable in that way, because if they feel ownership of it that isn't top down, then they'll run with it and you'll get some really good stuff out of it.
Yeah, and I think for ABCD, it's remembering it isn't yours. It really isn't. And I love things like peer support, but they do live in the world of service land, so you inevitably end up with that. With ABCD, it's about people coming together. And the way I think about it is don't compare it to service, compare it to your own life. I'm assuming, do you remember the summer? It wasn't that long, yeah. Did anybody go to a barbecue? And if you went to the barbecue, did you ask to see the health and safety inspection first? And after you'd been to the barbecue, did you fill in a 5-point star on the benefits to your health and well-being? And I'm suspecting you probably didn't. In the same way, my own street, of course, I'd have been shocked if we hadn't ended up being a bit of a ABCD strike. We have an annual firework event. It's probably getting a bit out of control, even I think that. But what we don't want is the council coming in and going, oh, we'll organise it for you. We're quite capable of buying our own fireworks, putting some safety lines up and doing it. In the same way, started in COVID, goes still to this day, Friday night street drink. All the houses, 18 of them in our street. It started on COVID, we'd bring out the wheeler bins and we'd serve cocktails around the wheeler bins. Now it's a bit more mixed. But none of us go through any food hygiene regulations for that. But we do keep an eye on the neighbour who doesn't drink as much and doesn't come out. They're still part of it. It's about you properly letting go and creating a space. I'm sorry, I'm going. I'll just pick up one. You cannot underestimate how radical ABCD can be, because loads of people say, oh yeah, we do that, and we have to go, you do great work, it isn't. One of the ways to think about it is it's called the Helpers Crossroads, which recognises that many organisations do 2 people, a lot do 4 people. People are moving towards with. ABCD is about the by space, and how do you nurture that so communities are doing it by themselves. And once you do that, you have to worry less about what you finance or your, DBS check or whatever else that might be.
Just a very quick one. So, I mean, just a real example of something we're doing at Blend Kitchen at the moment. We've got some funding to put together a number of meaningful activities, as the funding we called it, and one of them, again, it's peer developed, it's lived experience developed, and it's a men's mental health group, and it's been put together by people with lived experience. There's no other experts in the room, and they're delivering this. One of the NHS groups in Sheffield has linked onto that, and they're now supporting it. So we're seeing some really great support there. But it's been started on its own and it's going forward. There's another one which we're looking at, which is going to be based on diabetes. So it's going to be people who's suffering at different stages of diabetes. And of course, we're a Blend Kitchen, so we're using food and nutrition. So we're going to be using food and nutrition to help these people with diabetic backgrounds. But there's, in terms of what's stopping us doing, nothing is stopping us doing it. We haven't got any other support from anyone else there, and we're going ahead and doing it. We're going to be seeking support by doing it. So we're going to do it first and then seek support, as opposed to doing it the other way around. So I think it's go ahead and do it. I'm not saying don't worry too much, but use the experts you have. But then it's gaining that support from the experts in the healthcare community that we need afterwards. But by showing it's having some impact and having some results is where we're getting the recognition. And again, getting that Social Enterprise of the Year award gives us some real kudos to be able to knock on some doors. That's how we're doing it.
Lovely. And I might add just a little bit here, because I think it's tricky, isn't it? There's a confidence thing for us all, isn't there, about sort of how do we bridge that gap between, what we would really love to see is communities doing things by themselves, and actually, but the role that we can play in supporting that and making that happen, and where, you know, what are we going to hold up accountable to? Interestingly, when we did some work with that patient group I was showing you, the patient said we would like a little bit of training, just so that we feel secure, and we designed it together. And they said, tell us when you need to know stuff, when things come up. Who can we talk to if we're worried about stuff? And the other thing was, how can we develop a coaching approach in what we do, so that we're not telling people stuff, we're actually working with skills that allow people to, lead it themselves, and we develop that mutual participation bit. So we did do a little bit of training, but it was actually designed by the patients themselves and the communities. And I think that's often the key, isn't it? Get people involved. And ideally, in the end, you get much more to people going, hey, well, we're just going to keep doing this ourselves. We don't need you anymore, really. Lovely. There was one question from the Mentimeter, which just proves it does work, and it was actually probably more a vote of confidence for you, Justin. I think it was something like, can you roll out your kitchen coaching across the UK? I think it said. I don't know if I've misquoted that from what someone had said there, but sounds like there's a lot of appetite. Is it a scalable model?
I'd like to. I mean, we'd like to say yes. What we're really trying to do is actually create that model. So it's creating a model where you've got a community operation, which happens to be a food service-led business. A lot of the revenue we create is from the food that we serve, and then we do need some funding as well. But yes, what we've seen in the last 6 months in particular, as it's really starting to work, is a community hub. And now that it's working, we've got the NHS knocking our door. We've got local organisations like Rethink, Flourish, mental health groups knocking on our door that want to work with us. We've got some amazing relationships with schools now. So we're working with 2 really particular schools. One is a Bent Green school. It works with people with special educational needs. The other is a place called Woodlands Trust, which is in a very, very deprived area of Sheffield. And so we're taking kids on a 6-week cooking course. But what we're also doing is coaching them as well. So each of those children has an hour with me each week where we're just discussing themselves, their lives, whether it's their health, their mental health, or just their aspirations. We're working with them and creating this coaching approach with the kids. And these are 12 years old. So we're having impact at a really, really young age on how these guys are working. We're also then introducing that to the school. So the school are now looking at bringing coaching in. So again, it's this coaching culture that we're creating within Blend Kitchen. We would love to see us be able to create other Blend Kitchens where the whole approach is bringing the community, using the assets, and using coaching to develop. And that is health as well as other aspects of well-being. So I'd love to see it scaling.
Yeah, that'd be great. Any other questions from people? Let's have a look around. I know it's a big, intimidating room, isn't it? But any people want to add anything? I've got loads of things up my sleeve thinking about you guys here, and I'm thinking about, I guess I'm thinking, a room full of health coaches here. It primarily enrolls in services. You guys are experts at kind of like being not services in a lot of ways, and trying to build communities. What sort of, perhaps I could ask you all, what sort of relationship you would like to have with health coaches as they are? What would be most useful to you? And maybe can I come to you, June, first, maybe? And perhaps we'll go the opposite way. So June and then Justin and May and then Mick at the end, if that's okay.
Okay, so for me, being in a charity that doesn't have paid health coaches, I would like the paid health coaches to give that supervision and support to those volunteers. I think that when you're trying to run a service, they're working 9 till 5. They are doing health events at the weekends. We are seeing 50 to 100 people at each event. We're then trying to get back to each of these people. And what we're trying to do is then pass them back to the doctors, surgeries, and the healthcare assistants, and for them to take up the mental then. And it would be good if they then worked with us, to actually support those families, that person, to actually overcome whatever it is. So you're given 6 sessions, which someone who's working can't always give the 6 sessions, but it's just sort of like making sure that they sort of like support us, encourage us in our work, and take on the mental to say, okay, these 6 weeks we're going to sort of support this person and actually give some feedback. Because sometimes you'll say that this has happened and you'll hand them over, and then you ask for the feedback and it's it's sorted, or you know, whatever. So it'd be nice if we could work together and build a relationship with the healthcare assistants in the surgeries, because GPs aren't all, they, you know, allow the GPs to sort of like let the healthcare assistants come to our events and try to support us in that way.
I think for us, again, just a personal experience at Blank Kitchen, it's support in terms of training. I mean, obviously what Peak Health do is fantastic. For those that maybe not be able to afford that, something like that would be absolutely great. But I think that monitoring and evaluation is something that really missed out a lot of the time. So understanding what the impact's having. So if there's any way that that support can be given, and really understanding perhaps where an organisation is in some of the work it's doing, and then where it's actually had success. Because again, us as an organisation, we're not experts in the wider world of healthcare coaching, so we don't quite know some of the goals that we're trying to achieve or what else is happening out there. So a wider knowledge of what's happening in the industry would be absolutely fantastic. But I think that would be the key thing for us, I think.
So I would just invite people to come and see us. Or whatever your local community anchor is, just get out there. We're always keen for that. We're really pushed for time, like anyone, but we try not to use being busy as an excuse not to do things, and I say yes to everything. And there'll be people like me in everyone's community. And, you know, can I come and volunteer at your XYZ group and help out for a bit? And that way you're given some time as well, and get to know them, get to know the community you work in. So we work the primary care network of 42,000 patients, and every single one of them's different. And every single one of them's got a strength. And some of them, you know, don't go and make appointments with the coaches because they don't know who they are. But I know them, I know those people. And if I can say, oh yeah, go and see Sally, that really works. And we do that both ways. And that's what we do as the community development organisation, but also as a bunch of link workers, is that we're the link between those two things, the community and that, you know, GP practice or whatever. So if you can go and show your face at the library or the coffee morning that's going on so people can put like an actual person to it, it's not as scary, then that would be, I would invite you to do that. That will help.
I suppose two things, one of which is learn from what started right, went wrong, and is coming back again around social prescribing. And by that I mean, I think there's some real potential in that it was a great way for people coming into the system, GPs generally, to actually discover there was a world outside of just healthcare. But unfortunately, as it became over-resourced and professionalised, it just became a signposting, and it wasn't backed up with additional resources into community. But what I think you can do in your role, which is really key, and it's funny me saying this at a conference entitled Personalisation, because it is remembering not everything's just individual, some things are collective, particularly some of the issues people face and the barriers they face. So I'd ask for sort of 4 things, and I know a lot of you do this already, but bring people together that will have similar barriers. It might not even be around the same condition, but they will face similar barriers. Secondly, as I think I've already said, help that person celebrate what they've already got and recognise their gifts and their passions and their skills and knowledge, and think how that can be nurtured and utilised for that wider benefit. I think thirdly, help people not just connect to services, but to connect to community and neighbourhood. And finally, you know, just get out there and celebrate those communities that we all live in.
Thank you.
Brilliant. I really love that. Thank you. And in a second, I'm going to give you just a one last go, just to sort of any last kind of things that you would like to do. Well, you know, and it almost sounds like you've done that, I know, Mick, but I know there's always more. There is always more. But it's so it's really interesting, isn't it? You know, we've got although sometimes in the health system, health coaches may feel like you're sort of like, you know, coming in anew, maybe at the bottom of the stack of all these healthcare professionals, but actually to community organisations you have a huge amount to offer, and that role of supervising volunteers is a really interesting invitation, isn't it? You know, you could be the continuity, the connection between some of the more traditional services and a whole swathe of people out there who want to get involved. You know, and the relationships that you're building seem really, really important. So it's amazing how quickly an hour goes, isn't it? And so we are just coming to the end. So I'm going to just whip along the panel. And Justin, is it okay? I'm going to start with you this end.
Yeah, I mean, backing up what you said, sustainability is the big word I'm just going to leave you with. It's if we all in this room are helping people on this side of the table, it's sustainable. The coaching culture is sustainable. The health coaching culture will continue, and we're all going to do good work. So that's my little message: sustainability.
And I feel that in order for us to do well in the community, we need to make sure that the professionals, the ones that are actually being paid to do this work, recognise what's happening in the community and try and get involved a lot more. I mean, most of our volunteers, like when you ask them to sort of like do events, from January to March, we worked every weekend apart from do. So imagine that for 3 months, we were solidly doing volunteering events. So it'd be nice if health coaches came along and did some of them. Even if all of you just did 1 or 2 events in every 3 months, that would make a difference in the amount of people that's in this room. So just give something back. I know you're being paid, I'm being paid, but I also do a lot of volunteering in my own work.
So I guess my challenge to everyone is 2 things, because I'm inspired by Mick to add another thing to everything. One of them is around language and watching what language we use all the time, and we talk in, NHS language and conditions language and all of that kind of stuff. Part of being based and embedded and empowering your community is using the right language. I don't mean dumb it down. I mean use actual language, not NHS language, where possible anyway. And I guess the other thing is that invitation, that permission to go and get involved, to try out new things, to fail a bit, but just as long as you're learning from it all the time. So yeah, language and permission, there you go.
Thank you. It will save money. We didn't go down to the road. Because of that, it didn't have help. I had the best KPI of any senior local authority person in the country, which was, written into my job description, for everybody in Leeds to have 3 good friends. And the reason we did that was we know that people who have friends have less demand on higher level inappropriate services. And that saves a hell of a lot of funding. It also means you have a better life.
Brilliant. Thank you very much.
Thank you. Well, that is a great place to leave it, because we're going into another really important section, which is the coffee break. It's a half an hour, but as Mick challenges you, making friends is really important. So what I challenge you to do is to approach someone you haven't spoken to yet, and just with it, you've got the invitation permission now to just say, hi, how you doing? I haven't spoken to you. Have a conversation. But thank you very much to our panellists. Really, thank you very much again.